The last step is you get a baby in your hand without any problems. It's called live birth rate, which may be anywhere between 2 to 3 couples. Because I'm a very optimistic person, when you complete this 27 videos, you will come to me and ask for natural pregnancy. That is the saddest part of it. And I'm very happy. I will make you all understand. Beyond our nature, we cannot do anything artificially. And you all, because of your laziness and lethargy, we are all now going through all these shortcuts and ending in artificial treatments and all sorts of complications and problems. So now we are into the part 9 of no IVF, no ICSI, end to end, or say no IVF, no ICSI. So now the part 9 is nothing but success rates. Maybe this is a very interesting and inquisitive topic and a very awakening topic to everyone. I hope most of the couples would be lacking this information, and definitely I feel it will be very useful for you, because this success is one thing universally every couple will ask this question to everyone. I can say, I can vouch it is 100%. No couple will not go on without asking any clinician, what is the success rate of your center for me? So this is something very, very, very essential question also. So something we need to understand. Now let's understand the success rate is into 4 points. Only when you understand this success rate completely and deeply, you will feel its impact. And why I'm taking this as a separate part. So now let me say this success in a very simple and understanding way. Suppose clients are undergoing embryo transfer. So embryo transfer, 15th day post embryo transfer, we are checking the beta HCG and we are seeing for positive pregnancy. So by doing this beta HCG and we are getting positive pregnancy, say we have done 10 couples have undergone embryo transfer, 10 female partners, out of which if 7 partners have got positive pregnancy, that means it's called 70% success rate. Can you understand this at the first level? And this 70%, what you are getting with a positive blood test or a positive biochemical, positive beta HCG test, it's called biochemical pregnancy. So this is the ladder 1 or the first step. So moving to the second step, from here, from these 7 clients, what will happen? How many female partners are heading towards a heartbeat, which usually comes at the 10th week, 8th to 10th week. Okay, so the heartbeat happens means it is called clinical pregnancy. So what happens is, out of this 7 positive couples, maybe 5 or 6 couples would have got a positive heartbeat. 1 or 2 couples would have got dropped there. So now this is clinical pregnancy. Now the success rate is 50 to 60%. This is the second level. And from now onwards, the third level starts. That is your second trimester, 12th week to 20th week. This 12th to 20th week, so many problems are happening. Sometimes we do a anomaly scan between 20 to 24 weeks to confirm whether the baby is having no morbidity or any anomalies or any defects or any congenital defects. So sometimes if you come across some gross anomalies, we are asking the female partner or the couples to terminate the pregnancy medically, medical termination of pregnancy. So that happens in some time. Sometimes between this 12th to 20th week, so many clients will go for second trimester miscarriage, sudden fetal demise, IUD. So these are all the things happening and common. So what happens is, out of this 7, maybe 4 to 5 will be going through this ongoing pregnancy. So which means now the success rate is 40 to 50%. From here, the last step is you get a baby in your hand without any problems. It's called live birth rate, which may be anywhere between 2 to 3 couples. Which means when you go through this success rates, it can be 70 to 80% of biochemical, 50 to 60 of clinical pregnancy, 40 to 50 of ongoing pregnancy, and 20 to 30 of live birth rate. My dear couples, take this thing from me. This is not the data from me. This is not the observation from me. This is not my personal experience. This is the experience from the international journals and the publications, globally, worldwide. So definitely, when you cross these 4 stages, the pregnancy will start getting decline. So now you think you are getting this success rate is 70%, 80%, 90%. You are all getting impressed by that. You are all getting motivated, like you are getting interested, you get driven to that. So you go and start your program immediately. I'll get a baby. So now, why I should speak about this topic? It is purely on the second day of your cycle, when you are going to start IVF or ICSI. Ask this question to yourself. I'm done a uncompromised preparation for this program, for this treatment. Both the partners, it's not only the female partner. Equally, both the partners contribute for a healthy baby and a pregnancy. Whether both the partners have given the fullest effort and uncompromised preparation on the day 2. And did your clinician, the gynecologist, have volunteered or wholeheartedly came forward to start the treatment for you? Sometimes it happens, you may have a cyst, you may have a low pool of follicles recruitment in that particular month, but you are in the urge, some social problem or some mental pressure or family pressure, you want to complete the treatment, start the treatment early and complete the treatment quickly, because you are getting the information that IVF ICSI has high success rates. At least now you are able to differentiate what is this true success rate. Are you looking for a biochemical pregnancy that is going to sufficient if it is going to be 90%? Or all we don't want a live birth rate? To get a live birth rate, just a proper IVF ICSI alone is going to be sufficient for us. So let's have a proper understanding. Let's have this patience. Let's try to hold on for some time. Let's not put our pressure, because this body needs some time for healing, recovery. You have damaged this body without giving much importance, and suddenly you want to make this body perfect all of a sudden in a shortest interval time. Is this possible or this is feasible? Never. So have an understanding before starting your IVF ICSI. Think of the success rates, and always when you go and meet to any IVF center, ask them. And I'm also feeling most of the gynecologists and IVF centers, what happens is they are so busy in the day-to-day practice, day-to-day clinical progress. So they have lack of time to understand, research and analyze their own data, starting from biochemical to live birth rate. It's a very surprising, because they are all forced to go through the treatment, compelled to start the treatment. So what happens is they feel a bit upset, because we are seeing it's something very practical. Imagine a woman, most common problem is obese. She is overweight and she wants to take a shortcut. She conceived by IVF. She will end up in early labor, premature labor. The baby will end up in NICU. All these things can happen. These are all the risk factors. She may more prone to develop diabetes and hypertension during the antenatal period. Have anybody is getting this counseling? If we make this as a counseling, will anybody undergo the treatment? Where are we? So you have to think of yourself, put the real pain on yourself. You have to take it very, very seriously. Unless you are taking a primary initiative to get yourself properly prepared, the success rate is not going to increase, and you have to make sure your success is in your hands. Your positive is in your hands. The clinician is only, and the IVF center is only a supporting role. And you have to prepare yourself, and don't force the clinicians, and don't also allow the clinicians to start the treatment if you, after listening to all these videos, understand in any point you are not fully optimized or you are not fully prepared. So I hope this ninth part would have really triggered and provoked yourself to get yourself properly prepared and start the treatment if at all it is needed, because I am a very optimistic person. When you complete these 27 videos, you will come to me and ask for natural pregnancy. That is the saddest part of it. And I am very happy. I will make you all understand. Beyond our nature, we cannot do anything artificially. And you all, because of your laziness and lethargy, we are all now going through all these shortcuts and ending in artificial treatments and all sorts of complications and problems. So let's see in part 10. Thank you.